Today, I'd like to talk to you about Burning Man, Burning Woman's disease, or orthomyalgia. Now imagine, if you would, your hands and your feet are on fire. The pain is intense. You can't stand it any longer. And all you can think about is putting them in a bucket of ice water to cool them down. In 2024, the National Organization for Rare Disorders, a leading authority on rare diseases, reported that orthomyalgia affects fewer than 200,000 Americans. That's just 0.002% of the population. EM leaves its victims physically crippled and emotionally devastated. I have orthomyalgia. Every day and every night, I experience horrible, burning, hot pain. I have spent hundreds of hours researching peer-reviewed medical journals, and I'd like to share with you what I've learned. We're going to talk about the history of orthomyalgia, the problems with diagnosing it, as well as treatments. Well, back in 1878, Dr. Silas Weir Mitchell began documenting people with hot, burning hands and feet. This was the first formal study done of EM. Many people call this Mitchell's disease. That's not what he called it. He called it orthomyalgia. Comes from three Greek words. Orthos means red, mylos means limb, and algia means pain. So orthomyalgia means red limb pain. He also tied it to nerve failure, the same theory that doctors use to treat us today. In 2023, Dr. Ann Oaklander, a neurologist and researcher at Harvard Medical School, wrote in the New England Journal of Medicine that current research supports that small fiber neuropathy plays a key role in orthomyalgia, explaining the burning pain and redness experienced by patients. Now, EM is very difficult to diagnose. It's because it mimics other skin disorders. In 2023, Dr. Mark Davis, a respected physician at the Mayo Clinic, stated in Mayo Clinic proceedings, the diagnostic challenge of orthomyalgia is due to the fact that it's so uncommon and that the symptoms can mimic those of other conditions such as neuropathy, complex regional pain, and cellulitis. Many patients, in fact, most patients, will endure years of agony before they receive an accurate diagnosis. More and more, they're using genetic testing with much more accuracy. In 2024, Dr. Stephen Waxman, a Yale University neuroscientist, explained in the Journal of Neurology, mutation in the SCN9A gene has been found to be a major cause in inherited cases of EM, which holds out the promise for more specific diagnostic strategies. Now, treatment, there really hasn't been much. They try to manage the symptoms, cool the area, avoid known triggers, which might include warm temperatures, tight shoes, and spicy foods. Using topicals, use aspirin, gabapentin, and seeking counseling. Dr. Maria Lopez, a pain management specialist, wrote in the Journal of Neurology in 2023, while sympathetically has found some success in relieving symptoms, it's risky and it's usually reserved for patients who don't respond to less invasive treatments. This is a surgical procedure. They cut the nerves. It can reduce pain, but there are risks, and it should only be used as a last resort. One of the more promising treatments is gene therapy. In 2024, Dr. Waxman noted in the Journal of Neurology, targeted therapies that correct these genetic causes are a promising field for future treatment. Another cutting-edge option is implanting spinal cord stimulators. This one excites me. My doctor is in the process of making arrangements for me to have this procedure. In a 2016 study, Dr. Laura Marquez and her team published in the Regional Anesthetic and Pain Medicine, describing how an 80-year-old patient with orthomyalgia experienced significant pain relief after receiving a spinal cord stimulator. Dr. Robert Baina, a neurosurgeon at Banner Brain and Spine, explained how it works. We essentially fool the brain's pain pathway by transmitting weak electrical signals down the spinal column. The brain gets these little messages and it erases the pain signal. It erases the pain signal. So today there is real hope on the future. Now, we've discussed the history of EM, how it's diagnosed, and emerging treatments. The next time that you feel warmth on your face or a rise in temperature, remember that for some, this is pure agony. But with greater awareness, continued research, there is hope for relief. I'd like to thank you for listening to me today and allowing me to share my personal struggle with orthomyalgia.